helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm your host, Jen Lennon. Today I'm joined by Dr. Erik Arter from Thrive Health Systems, as well as Martha Bauman. She is a patient with Thrive. Welcome, you guys.
It's good to be back.
So Dr. Arter, let's talk a little bit today about when we can't figure out what's wrong, okay? I mean, I know people, they struggle, they go in for diagnostics, something isn't just not right, and we struggle. Where can Thrive help us in a situation like that?
Well, Thrive Health Systems, we often say, you know, our location, our address is at the end of your rope. We get a lot of patients who have been everywhere. They've searched out, you know, high and low. They haven't received a proper diagnosis or haven't received a diagnosis at all, or they've been told that something's in their head. They've been searching for a long time and they haven't been able to find an answer.
And that's where you can step in. And I know,
right.
Martha, basically you were at that location.
Oh, yes.
You were at the end of your rope.
I
So tell us
was.
a little bit about your story. By 2016, summer 2016, that was it, right?
That was it. I was in the hospital for a week with severe abdominal pain, diarrhea, vomiting. They couldn't figure out what was wrong. But, you know, I was just dusting around and caught the commercial with Dr. Arter and another patient describing the exact same symptoms I was having. I had reached rock bottom. I couldn't get out of bed. I had joint pain. Just couldn't think clearly. I was just losing it. But, you know, here I am today is living proof that, you know, with the help of Dr. Arter, I'm a new changed person.
So let me give our viewers a little bit of background. You're actually a nurse by
Yes,
training,
I am.
right?
Yes, I am.
So this must have been so frustrating to you
Yes, it
to not
was.
be able to get an answer of what was going on in your body.
Yes, it was. It was quite confusing because, you know, I had been asking for help and trying to figure out what was wrong, but they couldn't figure it out. Whereas with Dr. Arter, they have a whole broad spectrum of different tests that they do that general doctors don't do. And it was discovered the problem that was causing me to be sick.
And let me be clear, you
Yes.
were in bed on oxygen.
Yes.
I mean, this is hard to believe, just 5 or 6 months ago,
Yes,
right?
correct.
Amazing.
I started there since August of this year, and I'm a new changed woman, a completely 100, you know, turnaround. And I have to give credit to him for saving me, you know, giving me the new me. And so there's hope. I just want people to know, just don't give up. Reach out, seek other aspect if need be.
So Dr. Arter, Martha referenced that you ran some tests that she didn't receive in hospitals or things like that. So tell me some of the things that you looked for that helped you diagnose Martha.
Well, functional medicine, or in terms of foundational nutrition, however you want to call it, it's really what we do is just looking at the broad spectrum of what makes a healthy person. And so we often say that functional medicine is the study of health, not the study of disease. And so we need to find out why Martha wasn't healthy. And in this testing, it's not limited by what insurance covers.
Okay.
We're able to do 10 pages of information, whereas the general blood test, standard blood testing in offices around in medicine is really just 1 or 2 pages.
And what did
so-
you find in Martha?
Well, we actually found out that Martha had lupus, and that had gone misdiagnosed or undiagnosed. And so she came in pulling her oxygen cart like a suitcase, and just really just fatigued, talking about going into a nursing home. And you can see Martha's not nursing home material, right? So-
Absolutely not. And you have 6 children and how many grandchildren?
17 grandchildren.
So tell me how this has impacted your life with your husband, with your children. I mean, it's
It took
changed
its
your
toll.
life.
It took a toll on my family, you know, because I couldn't do the general things I used to do. I had no energy. I couldn't get out of bed most days, you know. I even hid it mostly from my church. You know, I would show up every Sunday with a smile on my face, but they didn't know the true me or what was going on deep inside.